What is going on, everyone? Welcome to the Breakthrough Performance Podcast. I am your host, Coach Evan, and today we're going to talk a little bit about injuries. Now, injuries are obviously a terrible thing, but we can't pretend like they don't happen, right? Everyone knows you're going to get a little bit of pains, aches here and there. They shouldn't be happening, but they do, and that's unfortunately a normal part of training. Now, before we get into this, I just want you to keep in mind, however hurt you may be feeling from training, you probably still feel better than if you weren't training at all. All right, so that's just something important for us to keep in mind there. All right, so what I'm going to cover today is when pains are normal, when they're not, how you can kind of improve recovery if you are dealing with something like that. Mainly sleep and nutrition, strategies to work around injuries and training, and why it's so important to keep your routine even when your workouts don't really feel too great. All right. So, first thing we're going to do is acknowledge that some pain is absolutely normal, right? Some pain, not a lot. Okay. When you're strength training, especially if you're new or you're returning after some time off, it's not uncommon to feel muscle soreness, joint stiffness, or some tightness. It doesn't always mean you're injured. It often just means your body's adapting, right? The process that comes with some signals, and learning to listen to them is part of growing as a lifter, as a workout person, which I know a lot of us are new to being, right? We need to kind of avoid this idea that every time you kind of feel an ache or pain, that it's something to be really, really afraid of, right? Movement is medicine, but only when it's done with awareness, okay? So, what do I mean by that, right? I'll just give you an example. I was just talking to a friend of mine who was saying, Evan, my deadlifts, they kind of hurt my back today. What do I do? And the first thing I said to him was, well, we have to understand if this pain is something that's getting worse over time or if this is just kind of like a one and done deal. Now, not to minimize anyone's experience with pain in the gym, but a lot of the time, especially in my experience, when people are experiencing some pain, it's just kind of a flare up on the day, right? You might be a little more stressed out. You might be a little inflamed. You might have ate bad. You might have slept poorly. All of these things are going to influence how your body perceives, again, the signals it's getting from training, right? You might have absolutely no structural damage at all, right? There's not really a one-to-one correlation between pain and actual structural damage. So we have to keep in mind first, is this something that's just popping up today? Or is this kind of a trend where we need to course correct? Okay, so that brings me on to the second thing I want to talk about, which is understanding when a pain is not normal, right? Because really it's not a normal thing, right? It's going to come up here and there, and there's definitely strategies we can have, as I mentioned before, to kind of avoid being in pain, but there are a lot of times when it is a little more serious of a thing. So what you really need to watch out for is if it's like a sharp stabbing pain or like a sudden pain with movement. If the pain lingers on or if it's getting worse with rest, it's definitely something to worry about there. Swelling, bruising, loss of range of motion, any numbness or tingling. That's a hard word to say for some reason. Numbness. Pain that changes the way you move or the way you stand. All of those are going to fall under this category of like, okay, let's take this a little bit more seriously. If my shoulder's just sore for today, all right, I go a little lighter, and next time I come in, I'm going to see if it's still hurting. If it's not, great. Like, clearly all I needed to do was get a little bit of rest, right? Rest and time are usually going to be all that you need. So it's important to just have that in the toolbox, right? With our toolbox of pain, the number one thing we can do is just go a little lighter, just rest a little bit more, okay? Super important to keep that in mind. But any of these kinds of things, again, like a sharp stabbing pain or something that's getting worse with rest, all of those are like, hey, coach, what's going on here, right? And, you might think of these as normal pains, but when in doubt, definitely ask one of the coaches because, obviously we have a lot of experience with movement, with working out. We can kind of take a look and see like, oh, well, you know what? The way you're performing this deadlift, whereas normally it would be fine, I can see how that would cause some pain in the knee. So let's make this a little adjustment here. Let's make this a little adjustment there. And sometimes it's that simple. So if you are ever feeling uncomfortable or anything like that, even if you think it is that more like the first kind of thing I was talking about earlier, where you don't really need to do anything, you kind of just need to rest, I would say still let the coaches know, all right? Because we push everyone different ways for different movements, like very, very specifically, okay? If you're coming into the gym and you're not feeling so great, you gotta let us know, because it's going to impact the way that we coach, right? And at the end of the day, we just want to help you out the best we can. So the more information you can give us about your, I guess, the way your body's feeling, the way it's working, all of that, the more we have to go off of, the more data we have to go off of to actually help you out, okay? So don't ever shy away from letting us know that something hurts. We might look at it and say, yeah, you probably just need to go a little lighter and rest. Most of the time, that's probably going to be the case, but not always, right? I'm pretty sure that's obvious to you guys, but just let us know. That way we can actually get a little more specific of a plan for whatever it is that you are experiencing, right? Now, let's say your back's messed up. Your back's messed up, you did some deadlifts, you need to rest and recover, or maybe it is a little more serious, and we've given you a specific kind of protocol for alleviating pain. It's never going to be the case that all you need to do is just move a little better in the gym. And we know this. There's always things we can do better. But specifically for pain, a lot of that is just going to be inflammation in the area, right? Now, you can probably guess where I'm going with this. How do we kind of reduce some of that inflammation? The obvious way to do that is Advil, but I'm not telling you guys to take Advil because I just don't think it's best practice to start doing that all the time. Obviously, it's common, and if you're in a ton of pain, go ahead, take some Advil. But the best thing you can do is absolutely just sleep more and eat foods that are a little easier on the body, right? Whenever I talk about nutrition, it's always coming from a place of, okay, let's take 100% of your daily diet and nutrition, and let's just carve out a little 5% change. A little 5% change, right? Because we're usually talking about nutrition in the context of like, this is super important for your lifestyle and we're trying to build sustainable habits. But if you're in a ton of pain, it might make sense to change up your nutrition quite a bit, right? Especially if it's like, I'm probably only going to be in pain for like a week or two. Can I just speed this up, right? In that case, we might suggest a little bit different of a different dietary strategy. Okay. Things you can do for that are going to be the classic kind of eating clean things to kind of avoid inflammation, right? So that would be something like avoiding excess sugar, avoiding artificial sugars, which is something that I don't actually typically recommend. I'm typically kind of a fan of using those as a tool to just not consume a ton of calories in our liquids. There's various things in there that we could talk about, like maybe lowering the amount of trans fats that you're consuming. All of these are going to be a little bit more beneficial to reducing inflammation. Again, this is a strategy that's not like necessarily full lifestyle, 365 days a year. Can I maintain this for 10 years? This is more of like, I'm in pain. What can I do to get out of it? Nutrition is definitely one of the things that we can improve to get that. Now let's take it back to sleep for a little bit, right? Because aim for 7 to 9 hours of sleep. You probably listen to that and you go, dude, if I could sleep 12 hours, I would love to, but I can't because I have a life, and that's totally okay. And one of my favorite Arnold Schwarzenegger quotes of all time, probably my favorite. I'll give you two because there's an honorable mention there. Probably my favorite one of all time is, oh, you got to sleep 9 hours? Just sleep faster. I just sleep faster. The second one is, milk is for babies, beer is for men, which I don't believe at all, but I just think it's a hilarious quote. Arnold was a funny guy back in the day. I think that's why he got so famous, because he's funny and jacked, and that's a cool combination. I try to aspire to be that. I think we're making progress, but I don't know. Right? Anyways, sleeping faster. Sleeping faster is this crazy idea, crazy sounding, but there is actually something to it. There's this thing called sleep hygiene and sleep efficiency, right? So trying to reduce like the amount of restless time you spend rolling around in bed, right? I use some wearables, some heart rate trackers, some blood oxygen trackers to see exactly like how well I'm sleeping. And there is absolutely a difference between when I implement my sleep hygiene strategies and when I don't. I'm not sleeping as well. I'm not breathing as well while I'm sleeping. I'm not going into as deep of sleep. And really, again, like it sounds crazy to say that you could sleep faster, but there are a lot of things we can do. So I'll give you a couple tips really quick. This is not the sleep podcast. I'm going to do one of these one day, but things we can do. Make sure your room's really dark. Really, really dark. Make it a little cooler, right? That's going to help bring your core temperature down, which is going to help you get into that restful state, right? We also have not eating too close to bedtime. That's going to be super important. Staying off the phone, right? Maybe taking a hot shower close to bedtime. That's also going to help you bring down the core temperature, because as the body is in the hot shower, it starts a cooling down process, and then once you get into bed with the cool air, that just helps further that trend, right? So again, same thing I was saying with diet. If these strategies work for you and you want to keep them in all the time, absolutely go for it. But if you are injured and you're wondering how to get out of pain, it's even more important, okay? When pain is high, you're probably going to feel a little more motivated to do the right things, right? So these are just tools that we have in the toolbox to, again, improve the rate of pain degradation, I guess. I don't know, pain degradation. It sounds crazy. What do I have here for the next thing? I want to talk about how to work around injuries and keep training, right? Now, you're going to listen to that and you're going to say, well, coach, isn't that your job? And I'm going to say, yes, it absolutely is. That is what I'm here for. That is one of the most important things I can possibly do. But this is a podcast, so I can talk about it for a while and I can tell you what's kind of going through my mind, right? The first thing we're going to do for working around injuries and keeping training is going to be lowering the overall load on the joint that is causing you pain. Okay. Now, that doesn't necessarily mean you're going to get less out of it. Sometimes it actually means you get more out of it, right? So my favorite thing to do, like if someone says this hurts, is I'll say go lighter, but go slower. Get more reps in, okay? You're still going to be able to push the intensity on the exercise. You're just getting more out of a lighter weight. And a lot of the time, the joints are just responding poorly to having a ton of weight on the system. So you can still push the muscles really hard while using a bit lighter of a weight that's going to be a little more friendly on your painful shoulder. Now, another thing we can do is we can identify the specific range of motion that's hurting you and go as close to that as we can with something different that causes you less pain. Now, if that didn't make any sense to you, I'm going to give you an example. And if this example doesn't make any sense to you, give me a call and we'll talk about it. I don't care. Go for it. Shoulder press. If your shoulder press is hurting you, going light's not helping, what are we going to do? Well, I'm probably going to have you lower the bench just a little bit. Gives you a little more freedom of motion in the shoulder. Sure, we're getting more pecs there. But that's okay because we're still getting shoulders and we're still training. And that's really, really important. I'm going to talk about that a little more later on. We can even get more cardio in, right? There's a million different things we can do in the gym other than the thing that hurts you right now. So if you are experiencing pain, again, let us know because we want to help you and we have a lot of tools to help you out, okay? Your back hurts on a deadlift, cool. Let's do a hip thrust. Not cool. You understand what I'm saying? We can still train the glutes and hamstrings without loading up the back a whole ton. And I think that's a beautiful thing. And I love helping you guys out with this kind of stuff. So please let the coaches know when you are in pain. If there's anything I can stress about how to improve your workouts as far as pain is concerned, it is to communicate the pain to the coaches so that we can help. Because that's what we're here for. And we do a pretty good job of it, I would say. Now, the last thing might be the most important. And that is that even when a workout feels bad, or even if you feel like a workout isn't going to be a good one, it's really, really important that we just continue to ingrain the habit of training into our head. Okay. Now, I'm very fortunate that I have been lifting for a very, very long time. So for me, it feels really, really weird to not be in the gym. Okay. Now, I am super, super grateful for that. Like, I built that habit on accident, but it's going to carry out probably through my entire life. Now, I'm not saying this to brag, I'm not saying this to gloat. I'm saying this because I want that for you guys, because if you want to be an extremely fit and healthy person and you want to be the kind of person who thinks of themselves as a gym person or active or healthy or any of that, we have to actively build that habit, right? So, whereas you might think, I need a day off. Even driving to the gym to go on the bike for 20 minutes and leave is way better than nothing. And that's not even because you're just getting cardio out of it. That is mostly because you are continuing to build the habit of exercise, right? For most of our people, you're a little newer to the gym. So if you miss a month of the gym, I hate to say it, but it's hard to get back in, right? So if you guys ever feel like, I don't know, should I go to the gym today? My back hurts. Should I go do this? I don't know. Yes, the answer is yes. The answer is not, yes, we're going to push through it. The answer is yes, because it's important that you're going to the gym to continue building the habits, to continue having that, okay, well, I just went to the gym, so now I need to eat healthy. Well, I just went to the gym, so now I need to make sure I'm sleeping on point. Lifting weights, as you guys all know, is kind of the snowball effect of healthier habits in life. And I know you guys want to be healthier and fitter and all that. I understand it. So I just want to be that gentle push to continue doing the thing that you know is right for you, which is going to be getting to the gym. Okay? If your legs hurt, you can't do any legs, that's fine. We have a lot of people, well, not regularly, but we've had a lot of people come in and we just say, you know what? We're not even touching legs today. We are just doing upper body. Or vice versa, right? Your shoulder is completely destroyed. All right, well, let's crush legs. We can still do that, right? Your elbow hurts on one side. We're going to give you some stuff to help you out with that, but in the meantime, just train the other side really hard, right? I cannot stress enough how important it is to continue being consistent in the gym, even when it's tough. We need to avoid, and I'm very, very guilty of this, we need to avoid what's called rigid thinking, this all or nothing mentality of 0 or 100. It's not, I'm a gym person, I'm crushing it 5 days a week, or I'm not going to the gym at all. Because if you do that, it's very, very difficult to maintain that 100% intensity. So even if you're just going to the gym to go through the motions, you're going to be so happy that you did it. Especially once you are recovered and you can kind of think, wow, I didn't actually lose that much strength. I didn't actually lose that much muscle. Yes, because even when you're just kind of going in on autopilot and going through the motions, you're still telling the muscles to stay there, right? You're still telling your cardiovascular system, hey, I know we're not pushing it too hard. We might not be making a ton of progress forward, but we're definitely not going backwards, right? And I just want you guys to keep that in mind, all right? Fitness is not about being 100% every day. It's stacking these tiny, tiny, tiny wins over time, even if that's just getting in the door, moving, and not quitting, all right? So just to wrap that up, injury doesn't mean stop. It means to adjust. You got to listen to your body and take care of the basics. Stay in the gym. We're going to help you out with anything that hurts. And I really hope that you guys get something out of this. If you do, give this podcast a like, follow, whatever you could possibly do. I honestly don't even know how to interact with a podcast like that. But yeah, I hope you guys find this helpful. And if you guys could give me some suggestions or some questions for the next episode, I would really appreciate that. All right. Hope you guys have a great day. Coach Evan out.